Hello and welcome to Two Peds in a Pod, the paediatric medical education podcast. Remember, you can hear our entire back catalogue of episodes on iTunes, Spotify, Google Podcasts, Amazon Music, and of course, our SoundCloud. So please tell your colleagues and friends and hit that subscribe button. I hope you enjoy today's episode. Hello and welcome to Two Peds in a Pod, the paediatric medical education podcast. My name's Ian Lewins, the host today, and I'm very, very excited to be joined this evening by Dr Katie McKinnon, who is an ST5 in paediatrics at the North Middlesex University Hospital in London. Good evening, Katie. How are you today?
Smashing. Thanks for having me.
Oh, pleasure. We invited Katie on because of a paper that she's been the lead author for. And this is something that caught my eye, and this is absolutely hot off the press. This is something from July's edition of the Archives of Disease in Childhood. And this is from the Archimedes section. And for people not familiar with the Archimedes section, Bob Phillips will be most upset. But more importantly, this is sort of people pick a clinical question and go, are we doing the right thing? And your clinical question was all about screen time and does it affect recovery from concussion in adolescence? So I guess my first question would be, what made you decide to do this? How did you pick it?
It was actually, we were in the process of updating some of the guidelines that we were giving out, patient information and things in A&E. And it was the head injury one. We had ended up using one from a different hospital, which talked about screen time as one of the things. And there's been a lot of sort of discussion generally about screen time in children with some of the stuff from the RCPCH. So it seemed like an interesting topic to look at.
Yeah. And did it sort of come off the back of a particular incident, or was it just sort of a general, we're updating the guidance, we need to have a look at this?
Yes, just a general question, really. But I have had patients, or more specifically parents, being like, don't you think you should tell them maybe to stop looking at their phone a bit? Yeah. And, you're always sort of trying to help the parents in that way, but also if there's no evidence behind it, it seems a bit silly.
Yeah. So the way these structured often is a scenario. So the scenario that you guys have written was that you've got a 14-year-old girl coming to A&E after hitting her head on concrete with a short period of loss of consciousness, has a CT head, which is normal, and she goes home, comes back the next day with symptoms of concussion, and her mum asks if avoiding screens would be helpful. And I guess that's a fairly common scenario that you and I sort of see in ED.
Yes, yeah.
So your structured question, I presume you use the sort of the usual PICO or the equivalent. So talk us through the PICO, if you don't mind.
So the patient being a 14-year-old girl with concussion, or a teenager generally, the intervention being limiting screen time, and the outcome improvement in symptom recovery. Okay.
So nice structured question. And I guess the first thing maybe to say for those, who don't do ED, what do we actually mean by concussion or concussion syndrome?
So concussion is mild traumatic brain injury from often sports related, but also other injuries. And it's pretty common. Mostly it gets better within a few weeks, but it can cause long-term problems.
Yeah, absolutely. So that's what we're thinking about. And we know that sort of some things seem to make it worse, some things seem to help with concussion. And I guess the specific question here is, about screens. So how did you do your search?
So we looked through the common sort of search sources, looking for concussion plus screen time or cognitive rest, which is a general term that's used in a lot of papers, and often that will include screen time as part of it. Okay. And how did you get on? What sort of hits did you get? Was it thousands and thousands of papers, or? Not thousands, but it was in the hundreds. But we did try to go broad at the beginning to see what sort of things were out there. And I suppose what we found a lot of was very general type discussion articles that didn't really have any meat to them.
Yeah. So sort of, we think this is a good idea, but we
Yes.
can't really prove it.
Exactly.
Okay, so what did you find when you whittled it down and you got your relevant papers? What sort of conclusions could you come up with?
Well, unfortunately, not a very clear, beautiful conclusion either. But there were some of the papers suggested that screen time did impact symptoms negatively. So limiting the amount of screen time did improve the recovery from symptoms. But on the opposite end, having no cognitive stimulation at all and complete screen rest also seemed to worsen the duration of symptoms. And so actually probably it's a bit of a balance. There were also some papers that discussed specific elements of screens, like reducing the brightness or making the text bigger and things like that, as a way of sort of minimizing the stress from the screens.
And so that's really interesting to sort of kind of unpick. In terms of limiting screen time, did they sort of set a, above 4 hours is bad, below 3 hours is good? Were you able to sort of establish what they meant by lengthy screen time, or did it vary hugely?
It did vary quite a lot, and a lot of the studies sort of described cognitive rest in very vague terms or in different groups, so like high intensity and low intensity. And in some of those cases, screen time appeared in both of those groups. But so things like, leisurely watching TV would be considered low intensity, whereas, working on an essay on your computer would be a higher intensity.
Yeah. So I guess you're kind of active versus passive almost. Yes. And just expand a bit more on the sort of not enough or too little screen time. What were sort of the sort of thoughts about there?
So there was a phase within sort of concussion management of the cocooning, where people should be completely, kept in a dark, quiet room for several days with no interaction, as a means of trying to reduce the impact of the concussion. But actually that seemed to have completely the opposite effect, and you do need some sort of neuronal stimulation for the injury to resolve.
Okay. And I guess, for lots of teenagers, I'm thinking of my kids, certainly, that's how they socialize a lot of the time. That's how they communicate with their friends, is all done by screen time. And I guess if you are saying you're limiting that, maybe it has other potentially negative effects.
For sure. There was a really interesting paper about what's the worst thing about concussion for you, was basically the question they asked this group of teenagers. And the symptoms were obviously up there, but actually very closely behind was the impact on them not being able to do the things they wanted, be that talking to their friends, playing computer games and so on.
Yeah, which they'd put up with a headache and those sorts of things to sacrifice for chatting to their mates, I guess.
Yeah.
When people are sort of assessing, the severity of symptoms, did you find that they tended to use the same almost scoring system, if you like, for assessing severity of symptoms, or did it vary?
Again, it was pretty varied. We weren't able to sort of compare like for like at all. And indeed, some of them used screens as their tool for measuring, which was a bit counterintuitive. So no, it wasn't very comparable.
Okay. And a note. So again, the other thing you mentioned about the screen is some things about brightness and font. And did they sort of find anything useful there, do you think?
So again, it wasn't the most sort of quantitative of assessments, but qualitatively, some students did say that reducing the brightness, making it easier on their eyes, did improve not necessarily the recovery to recovery from the symptoms overall, but in terms of making their symptoms worse whilst using them.
Yeah. And just the other thought of sort of thinking about my kids and when they use their screens, I don't know, did anybody look at time of day? Because I'm thinking, they tend to use theirs of an evening in bed before the cutoff comes and evil father switches their screen time off. And did sort of time of day, did anybody look at that, do you know?
No, they didn't. They did they looked at, again, I suppose it's similar in terms of the intensity of the use, but like leisure use and use for work, and using it for work did seem to be worse. But no, time of day, no.
Okay. Just a thought. Were these, the other things that when we talk about concussion and particularly things like exercise, so, the kids I often see are rugby players, hockey players, those sorts of people, and we talk about sort of a graded approach to return to things.
Mm-hmm.
Were these, could these papers sort of accurately pick out and say, we've been able to account for variations in exercise, for example, and just isolate screen time? I guess that's really hard to do.
Yes, no, not really. It was looking at sort of the whole picture and the different areas of cognitive rest and physical rest. And they did seem to suggest that physical rest could be limited in terms of getting people back moving more quickly, and that it might be the cognitive rest that's more relevant to the symptoms. But it's hard to pull apart.
Yeah, exactly. I think one of the things I thought was really relevant and interesting about the paper you've written is all the papers that you looked at largely were American.
Yes.
Why do you think that was?
I've had a real insight into the American sporting world that I didn't ever particularly want. There's so much legislation around concussion in America. Like every state has different rules, and almost all of them, after any potential concussion, someone has to be assessed by a doctor before even getting back to the game. So I think partly because that plays such a big role in their sporting lives, that has meant that they've done the tests there.
And I'm sure I remember seeing a paper sort of a year or so ago of, as you say, the really thorough assessment that they need even from minor injury, and people on this side of the Atlantic going, this is really bonkers.
Yeah.
This seems totally over the top, and stopping kids from doing exercise, and they've got to be assessed by a paediatrician and that sort of thing, which we just don't do this side of the Atlantic.
And I don't know if it's because they do different sports that are more prone to concussion. I mean, rugby's pretty violent at the best of times, but some of the sort of ice hockey and things do seem to be up there with the highest rates of concussion.
Yeah, and I guess the slightly cynical part of me might say there's also sort of a legal side of things, isn't there, with the sort of suing and that sort of thing.
Mm-hmm.
Are we doing anything outside of America looking at these? You do mention a study that's potentially looking at this.
Yes, I in fact can't remember whether it's in the UK or America, but there is a trial that's ongoing at the moment looking specifically at the impact of screen time on recovery from concussion. And I had a check today, and it looks like they've finished recruiting, but they haven't published the results yet. So hopefully we'll hear soon.
Something specific looking at screen time, that would be really interesting.
Mm-hmm.
So having sort of looked at that, what's your view and the view of the team that you're involved with? What was your view of the evidence for limiting screen time? What was your conclusion, I guess?
Generally a personalised approach. So if looking at a screen is making you feel worse, then don't do it. Basically, any activity that worsens symptoms should be limited until the symptoms start to get better.
Okay, and I guess the converse of that is true. That if actually you're coping with this fine, and you're able to do these things, then maybe a blanket, you can't do this for this period of time, isn't quite the right approach.
For sure. And they're probably not going to follow those rules anyway.
Yes, and that's probably the most relevant part, isn't it? There's no point us giving this advice that people aren't going to follow.
Yeah.
And I really like that kind of tailored, personalised approach, because that's what we should be doing for these people.
Mm-hmm.
So then coming back kind of full circle and thinking about the guidelines, what sort of impact has this had on your local guidelines?
So I think, firstly, it reminded us all about the importance of giving some advice about concussion, because it's really easy when you've got a busy department to just see the children with head injury, say they either need a CT and they're fine, or they don't need a CT at all and are fine, and actually to warn them that they might have ongoing symptoms and to think about that. And I think, yes, discussing it in a more sensible way with them seeing what works for them is more likely to get them on board going forward.
I agree. And just as a thought, I'm just thinking locally, one of the things that we do is we have a clinic, an emergency clinic, that we can bring people back who are sort of potentially have signs of concussion to do assessments. Is that something that you have locally, or who does the follow-up potentially?
To be honest, we don't often follow them up unless they return themselves. I suppose just in terms of the number of children it would be. But yes, do you follow every child with potential symptoms?
So it's on a case-by-case basis, but certainly, we give advice on, generic advice on head injuries, advice on concussion, and what to look out for. But if they I guess largely it's if they represent, or we give them symptoms to watch out for, they can ring our department and we can make an appointment for them to come and see us, get an assessment, and sort of get a slightly deeper assessment and deeper advice on sort of management of concussion. If they are sort of particularly sporty, I think we tend to have a tendency to follow them up a bit more, because we recognise that, if it's a head injury that's occurred during hockey, something like that, we recognise that we need a balanced approach, and we tend to do the sort of the questionnaire to see how they're getting on and give them to sort of take away with. So it does tend to vary, and of course the interesting thing is they are largely teenagers. We just tend not to see it in younger kids, who are the ones who often bang their heads more.
Yes, true.
Which is interesting.
I mean, so our department, the A&E team, don't really have any clinics, so it would end up being with the paediatricians, who are generally less familiar with these sorts of things. So at the moment, it does seem to just be that they come back to A&E and we go from there.
They need it. Okay. That's fantastic. Just on a totally unrelated, is this the first sort of thing you've written for Archives and had published?
No, it's not. I mostly like neonates, but also enjoy learning about other things. So that's how I ended up doing this paper. So I've written some baby-related things. And
so, I mean, from my perspective, when I was a trainee, I didn't even get anywhere near writing anything like this. It seems incredibly intimidating to do this. How have you found it, and what advice would you give to sort of anybody in your sort of position who's thinking about writing something?
I mean, I would definitely recommend the Archimedes part as an option, and education and practice generally, both for reading and for writing things for, because it really is sort of practical, useful questions and things, and it isn't as overwhelming as trying to do, a big research project, or, it's a sort of small, contained systematic review, and there are definitely questions that need answering.
Yeah, I totally agree, and I think this is one of the reasons I like Archimedes so much. Is it often comes up with you sort of sit and think, we've always done this. Is this absolutely the right thing to do? What's the evidence for doing this?
Yeah.
So thank you so much for joining us. I guess we should also sort of give a shout out to the other people involved in writing the paper, who were Alexander Hunt, who, as I understand, is F2 starting ST1 with you soon.
Yep, we convinced him to join the team.
Brilliant, excellent, well done. That's definite round of applause for you. And Dr. Katie Knight as well.
Yes.
Who's a consultant also at North Middlesex. So thank you to both of them for help for writing this with you. So thank you so much, Katie. I think that's been really helpful. I look forward to the paper coming out to sort of look specifically at screen time. But thank you so much for your time.
Thank you.
Thanks for taking the time to download our podcast this week. If you enjoy our podcasts, please tell your friends and colleagues and subscribe to us on Spotify, iTunes, Google Podcasts, Amazon Music, and of course, our SoundCloud. Thanks for listening.